Irritable Bowel Syndrome Awareness Month lasts all throughout April. It's a fairly common condition and it has several possible symptoms. The International Foundation for Functional Gastrointestinal Disorders defines irritable bowel syndrome, or IBS, as episodes of abdominal pain paired with diarrhea, constipation, or both. It's the most common gastrointestinal disorder, with around 15% of the world's population suffering from it. The majority of those diagnosed are women, around 60%. IBS has been connected with hysterectomy and ovarian surgery, with nearly half of those women with the condition, making it a major health issue for females. It's estimated that healthcare costs related to IBS are nearly $21 billion a year. The specialists at Advanced Gastroenterology and Surgery Associates explain the many causes of IBS.
Irritable bowel syndrome is a chronic condition, the most common reason that we actually see a lot of patients. The one good thing about irritable bowel syndrome that I tell patients is that it won't kill you. You may feel as though you're dying, but you're not. In the past, we called it a diagnosis of exclusion. However, now there are sort of definitive parameters. You can actually make a diagnosis just based on the patient's symptoms. If someone has chronic abdominal pain associated with changes in bowel habits, and it's been going on at least 3 times for the past 6 months to a year, then you can, by what's called the Rome criteria, diagnose them with irritable bowel syndrome. Now, of course, these are patients without warning signs, meaning no weight loss, no poor appetite, no blood in the stool. And it can be divided into diarrhea predominant, meaning that the patients mainly have diarrheal symptoms, or they can be constipation predominant, where patients have mainly constipation, or you can have both, alternating constipation and diarrhea. But it has to be abdominal pain associated with changes in bowel movements. And then there are no other warning signs, then you can make the diagnosis of irritable bowel syndrome. There are many various things that potentially could cause it. There is an entity of post-enteric irritable bowel, where patients who've had any gastrointestinal illness may develop symptoms of irritable bowel. The symptoms may linger. They may get better, but linger a bit longer than they normally do. We know that something triggers it. It could be virus, could be bacterial, could be a food toxin, but it triggers this abdominal pain with changes in motility of the bowels. And in the majority of patients can be sort of chronic, but they may feel terrible, but it's not pathological. It doesn't necessarily cause your mortality.
Advanced Gastroenterology and Surgery Associates have offices in Leesburg and the Villages. For more information about their services, please click the Irritable Bowel Syndrome story link icon on our homepage, yourhometownhealth.com.